Today I want to tell you a story about two women and breast cancer. Now that may not sound very intriguing because I know we all know a lot about the stats of breast cancer. 1 in 8 women in her lifetime will be diagnosed with invasive breast cancer in the U.S., and a woman dies from breast cancer every 13 minutes in the U.S. But I want to tell you another statement, and that I think you've also heard, and see how you react to that. And that is that cancer is the great equalizer. But I'm going to introduce you to two women. Their names are Betty and Anna, or let's start with A and B, Anna and Betty. And I'm going to let you decide if you think that cancer truly is the great equalizer. Okay, so the first woman is a woman who's grown up in a financially secure household. She's from a large metropolitan area, and certainly breast cancer would be a scary diagnosis for her, but she knows that she's going to treat it in her culture very head-on. She's going to get the screening, she's going to get the treatments, and she's going to work with healthcare professionals that are nearby. So she could kind of take it in as part of her life. But let's go to the second woman, who is Betty. Now, Betty's from a small rural community, and I actually feel like I know a little bit about Betty because I actually grew up in a community almost this size. But here's the thing for Betty. When Betty hears that she has breast cancer, it sounds like a death sentence. Because in Betty's world, regular screenings are not part of her routine. Sometimes there's no insurance, and then the treatment centers, the cancer facility treatment centers, are likely hours away. So the thing about Betty is she's seen too many women die from this disease. So she tells herself, I don't want to know. So you tell me, does that sound equal to you? Okay. I'm passionate about breast cancer because breast cancer is really part of my story. I was diagnosed with breast cancer about 15 years ago when I was president of Church's Chicken. And I was the first woman to lead an international restaurant brand, and we were publicly traded at the time, and you know, any kind of negative news could have hurt the business. So here I was with this disease, and I thought I had to worry about Wall Street. So regrettably, I kept silent about my treatment and my diagnosis. And I treated this just like any other business problem. I created a plan, I worked the plan, and then I powered through all my duties, having a double mastectomy and chemo. But here's the good news. 5 years later, I got a call from Susan G. Komen for the cure. And they asked me to be their president and CEO. And it was an honor that I couldn't refuse. It was an offer that I couldn't refuse because finally I could break my silence and become an advocate for breast cancer on one of the world's most visible stages. But there's some things that my experience for Komen didn't really prepare me for. Once we started going around the world and across our nation, I became aware of much more dire health disparities and health problems than I ever would have imagined. The thing that I want to make sure you understand about these two women, Betty and Anna, is that they are real people. They're not just examples. And when we talk about other women in our culture, you have people who have come from cultures where they've seen too much discrimination in the past. I mean, you think about Latinas, you think about African American women, Africans, bisexual women, lesbian women. Sometimes they have been, there's mistrust with the healthcare professionals. There are language barriers. Sometimes there's discrimination or insensitivity that really has them fundamentally disenfranchised from taking charge of their own health. So that just really, doesn't work. We did a study in Mississippi. And I came face to face there with women just like Betty who simply didn't want to know that whether they had breast cancer or not, because they felt hopeless and powerless in the face of a positive diagnosis because they just did not know if they could really get treatment. And frankly, they had seen just too many people, friends and family, actually die from the disease. So, moving on to around the globe, we have to understand that there are, and I'm sure you do, that these healthcare disparities are not just across the U.S. I mean, I certainly learned, again, at Komen, that the disparities around the globe can be, even worse, and I don't think that's a surprise to anyone. But an eye-opening experience that I had in the Middle East was learning that some Middle Eastern women didn't want to have a breast screening because of the stigma of the disease. And what happens with some women in these communities is that a mother's diagnosis of breast cancer can derail her daughter's prospects of marriage. And then in Ghana, West Africa, the cultural barriers there are so severe that sometimes when a woman gets advanced breast cancer, the stench is so powerful that she is forced to live outside. She leaves her house and lives outside. And yes, I said the literal stench, because here's what happens. When you have breast cancer that's advanced and goes untreated, the tumor grows outside the body and produces a really horrible odor. So this is a story about breast cancer, but it's much broader than that. Breast cancer is merely a microcosm to talk about diseases around the world. You think about chronic lung disease, diabetes, HIV/AIDS, the things that we all hear about. These diseases are still very much a death sentence for many people around the world, either due to lack of access, cultural barriers, you name it. But here's the good news. We are here in Atlanta, Georgia, and Atlanta is truly a global health capital. We're home to the CDC and the American Cancer Society. Morehouse School of Medicine has a center of excellence that's actually working on healthcare equity across the U.S. We have Emory University, we have Georgia Tech, and they are training innovators and technicians and engineers and all those kinds of things to work on crucial biomedical advances. So we're very lucky about what we have going on here in Atlanta. Also here, we have over 200 health IT companies, and these people are working to make sure that telemedicine and things that truly can help people who are disenfranchised for various reasons get their health care. We also have over 15 local colleges and universities that are training in health IT, and they're trying to make sure the next level of innovation truly does help here in Atlanta. So part of our role at the Metro Atlanta Chamber is to give visibility to these medical things that are going on, especially in the biosciences and health IT. And our hope is that when we bring visibility to these companies and universities, and when we see the growth that happens there, that growth and that visibility will cause new investment, and new investment could lead to the next breakthrough in healthcare. So, quite simply, we are trying to work on giving people more options. And these are myth-busting options that raise our awareness of risk factors and preventative measures. And they're life-saving options that make us think that we can have better treatment and even cures for some of the deadliest diseases. And these are also empowering options, and we want to inspire men and women to disarm those cultural barriers and to fight tirelessly to make sure that disparities are not something that we live with forever. So remember Anna, the woman that I told you about in the beginning? Well, her real name is Kier, and she's my daughter. And after I had my breast cancer and was diagnosed and treated, she underwent genetic testing. And unfortunately, she has the same BRCA2 gene mutation that I have. So the good news is she's cancer-free now, and she is under the care of a high-risk breast cancer specialist at a university research hospital. And she will continue to have regular screenings, but she's also going to undergo in vitro fertilization to select only her eggs that don't have the gene mutation to be fertilized when she is ready to have children. So, due to this latest biomedical technology breakthrough, this particular type of breast cancer will be eliminated from our family tree. But isn't it about time that all families had those kinds of options? Isn't it about time that medical resources were available for more than just a handful of people in the world? So I posit to you that access, not cancer, is the great equalizer. Thank you.